Guys, I hope you're doing good. I'm also doing good. I thank God for this day, of course. So, welcome to my lectures. I've realized that most students normally concentrate a lot on theoretical framework rather than the practical bit of it, which is normally taking place in hospital setup. So that's why I've decided just to come up with also lectures in radiotherapy under clinical practice that will be hospital based. So I'll have a series of lecture running parallel to the theoretical bit that I've been also covering. So these ones will be for practical bit of radiotherapy process that is normally done in hospital setup. So I'll start by looking at terminology review and overview of radiotherapy, which will form my first topic, which will have a series of lectures. Under this topic, I have certain objectives that I'm supposed to achieve. One, I'll review anatomical terminologies used in radiotherapy and also reflects on the application in practice, and also review radiotherapy terminologies and at the same time also reflects the application in practice. I'll also introduce and discuss an overview of radiation oncology departments in radiation therapy process, of course. And lastly, make you understand the roles and responsibility of radiation oncology team members with the scope of practice. Thank you so much. I hope you'll enjoy the lecture. Welcome. So before I look at my first lecture, there are vital machines that are normally used in radiotherapy department. So we normally have got computed tomography, which in short, it is normally abbreviated as CT. So this one is normally used in doing what is called taking the images of the patient so that we do what is called treatment planning. So using the treatment planning system. It can either be accurate depending on what your center is using. And then we also have a linear accelerator machine on the downer part. And you can see the linac itself where the gantry is placed at 90 degrees. So this one is normally used in treatment of patient. It's either photon treatment or electron treatment of cancer. In the first lecture, I'm going to look at anatomical terminologies that are normally used. We have the plan anatomy, which involves viewing of the planes. You see the images, the CT images are always in form of slides. So you have to go through them. So that's what we talk of plan anatomy, viewing the planes. Then direction anatomy deals with understanding the directions. At the same time, position anatomy deals with understanding the positional terminologies. As we all know that wisdom is not a product of scoring, but a lifelong effort to acquire it as Esther asserts it. Therefore, you're in the right position as much as you're going to follow this lecture to the end. So, plan anatomy. When you talk of plan anatomy, this involves viewing planes either transverse, horizontal, or cross-sectional. So, we have coronal, we have sagittal, we have oblique. Now, when you talk of sagittal plane. Sagittal plane divides the body into right and left. Equal part. So we have the right side and the left side part of the body. That is sagittal. Then when we talk of transverse divide the body into inferior and superior part at the middle. That's what is called the transverse plane. Then we have the coronal plane. The coronal plane divides the body into anterior and posterior part. I know that most of these terms you may not be conversant with, but in a medical setup, you have to be conversant with some of the medical terms, which you may not find in the outside world. Then we have the oblique. The oblique is whereby it is a plane divides the body in an angle, at an angle, which is oblique angle. You can see the two. Okay. Now, under directional anatomy, we'll also look at the standard anatomical position. Now, what is standard anatomical position? We're going to look at that in our lecture 3. So, standard anatomical position is universally accepted reference posture used in anatomy so as to describe the locations and relationship of the body parts accurately and consistently. The main purpose of using this is because it's a common frame of reference so that anatomical terms like left, right, interior, posterior, medial, and lateral always refer to the same orientation. So the persons who is the patient whom you're treating is what you normally refer to. It's either left of the patient or right of the patient, not the observer. Always remember that. Otherwise, Thank you so much for attending this lecture. In our next lecture, we'll talk about standard